My name is Staff Sergeant Stephen Still from the Defence Medical Academy. We're going to discuss in this lesson care for the dying patient. By the end of this lesson, you'll be able to discuss what is meant by death and dying and what physical changes occur with the dying patient, discuss patient needs during the dying process, discuss do not resuscitate, discuss last offices and the practical application, and also the religious implications. What is death? Death is the final stage of life. It is the natural result of the life process. It is inevitable. Physical changes in a dying patient. Responsiveness changes, so we talk about the consciousness level, they may become less conscious. Body function slow, so you might notice a drop in urine output. Muscle control weakens, they can't physically move themselves as much. Respiratory pattern changes, so the breathing might drop off, the respiratory rate will drop off, and also they might be breathing fast then slow. Circulation pattern changes, same as before. It will slow down, it will speed up, it will slow down again. Skin changes, the skin will turn to a grey colour, and the senses change. Often the last sense to go is hearing, so just because they're unconscious, don't think they can't hear you. Patient needs. Physical needs, talk about supportive devices to make them comfortable. Touch, they want tactile contact with people. Position, make sure they're comfortable. You can move them as well, so if they're uncomfortable on one side, move them to the other side. Bedding, rotate the bedding, make sure it's clean on a daily basis. Care for the skin, mouth, nose, hair and eyes. The skin may start to break down if they're laid in one position, so make sure that wounds are dressed and cleaned regularly. Psychological, listen, they want to talk, let them express themselves. Make time for them. Touch and contact comforts them. Don't shut them off, don't isolate them. Social. Family support is important. They want to know their family is going to be supported during this time. Allow visitors out of normal hours. Spiritual. Spiritual beliefs are very important to a lot of people. They will have their own beliefs and what they need to do during the dying process. Make sure you're aware of that and you respond to their needs. Bit more on spiritual needs. So extra guidance and support will be available. In the trust that you're working in, there will be trained personnel to deal with this. Make sure you engage with them as early as possible. Religion. Religion is important to many people. Make sure that you're conversant with what their requirements are. They will tell you. There are specific rituals required in certain religions. Make sure you're aware of that. Religious artefacts. Sikhs have religious artefacts they wear throughout their life. It's important that they're not removed after the dying process has been completed. Just be there and care for them. Be aware of differing religions having differing requirements. Okay, definition of do not attempt CPR. Produced by a clinician in charge of a patient. DNARs are not a legal document, but it may be linked to a living will. Patient's consent is not needed. Applies only to CPR. So other care that a patient requires is not included in a DNA. No requirement to be known to either the patient or their relatives. This situation is very unusual, however. Where a DNAR is in place, a patient or their family cannot demand resuscitation. Last offices. Care after death has historically been referred to as last offices. It is used to refer to the final act performed on a person's body. Last offices, sometimes referred to as the laying out, was the term for nursing care given to the deceased patient which demonstrates continued respect for the patient as an individual. Okay, we remove top bedclothes and place in a bag for laundering. Lay the body in a supine position with the head supported by one pillow and the limbs positioned naturally. Close the jaw and the eyes and cover with a sheet. The body should be washed, labelled and dressed in a shroud prior to removal to the morgue. The body should be treated with dignity and the same respect as any other patient. So in summary, we've discussed what is meant by death and dying and what the physical changes are with the dying patient. We've discussed patient needs during the dying process. We've discussed what a do not attempt resuscitation is. We've discussed the last offices and the practical application, and also the religious implications. There's some references for further information.